Hello.
Hello.
How are you
doing? Good. I have all my questions ready for you.
Good. Sometimes all these can be like, all the preventative health stuff can be like really overwhelming. So like also print it out, you know, there's different task force have different recommendations. So
yeah, I'm trying. And I was going to try and reassign host.
I mean, I can still share my screen. Oh, let's disable. No, I can't share my screen.
Now you're host.
Okay.
All right. I am proud to introduce Miss Joey Schmuhl, and I'm going to let you introduce your background because there's things I probably don't know about you. And once you've introduced yourself, we will talk about the topic we're going to cover today and why it's important. So give us your little background on yourself so that listeners can see who you are.
Okay, well, my name is Joey Schmuhl. I have about 9 months left of my doctorate program in nurse practice. Prior to that, I worked as an assistant scientist in immunology research and also worked as a RN for the past 10 years. I have been a member of EHP for the last 3 years, 3.5 years, and also run some half marathons and enjoy just getting out. So I think that's where my philosophy on healthcare comes from, is just that idea of preventing healthcare problems and my background in immunology and nursing. So I'm excited to talk to you today about this.
Awesome. So our topic today is basically what types of questions should you be asking your healthcare provider about preventative care? And so the first thing I want to dive into, Joey, is like, how do you see preventative care different than like your traditional medicine?
So traditionally, medicine was to treat problems. So you would go to the doctor if you had a problem. I have pain in my leg, I'm going to go to the doctor. I have headaches, I'm going to go to the doctor. So that in the past, I would say 3 decades, we've shifted that focus to preventing these illnesses. And so there's been a great deal of research in how do we prevent these problems from happening in the first place. Gratefully, this has extended human life. It's made our lives better longer so that we can live more active and healthier lives for a longer time. So not only extending our life, but extending the quality of the life. So things like decreasing strokes because of blood pressure prevention, things like that. So that's where healthcare is headed. We're headed to preventing these things. It costs less overall to prevent healthcare issues than it does to treat healthcare issues. So
exactly
that's where it's headed.
And I know, most of our audience is going to be particularly health conscious. And so, I think a lot of people are like, well, I'm healthy, and they don't go in for their annual checkups. So do you still think it's beneficial to go have that preventative care visit? And if so, what types of things should you be talking with your doctor about?
So there is an argument that preventative care doesn't need to be on a yearly basis. I think most of us have been drilled that, hey, you need to go to the doctor at least once a year. That may not be necessary for you. It kind of depends on your age and your comorbidities. It also depends on your genetics. If you have a family history of hypertension, hyperlipidemia, you could be the healthiest person. You could be an endurance runner, and you could still have hyperlipidemia. You could still have high blood pressure. So, so genetic factors play a huge part in this too. Certainly, anything we can do to reduce the risk of complications from genetic factors is very helpful, but it's definitely something you need to discuss with your physician on how often should I be coming in. Clearly, once you reach the markers of 50 and above, then definitely yearly. But prior to that, that could be for debate. So that would be a good topic to have with your healthcare provider based on your risk factors. And we can talk more about risk factors too on some of these preventative topics.
Yeah, so let's say, you maybe have a light family history of some things, nothing crazy. and you're only going in every couple of years, are there particular labs or things that you should get drawn? I mean, we all know that they do height, weight, temp, pulse oximetry, and blood pressure, right? So that's like if something's off, like something's really off, it's going to catch it. But what types of labs maybe would be a good discussion to have with your doc to see what's going on?
So I think one of the biggest changes is when these labs are being recommended now. For instance, your cholesterol and lipid panel is now suggested that they run one on you as a child. So about 9 years of age, they'll run a lipid panel, and we'll see how, because genetic factors in hyperlipidemia are dyslipidemia, which is just your numbers are off, you're not really high, you're just kind of, you got high LDL and low HDL. So they're catching that now in children so that they can prevent the factors later. And again, with hyperlipidemia or dyslipidemia, there are dietary and physical changes we can do to control that within a certain range. So if you know that your child at 9 years old has this predisposition to hyperlipidemia, you know, over time we can prevent the damage that that would cause. So definitely, if you haven't had your lipids checked in 2 years, you're going to want to get that done. Blood pressure has changed too in the past decade. The recommendations for blood pressure used to be, you know, basically if you were over 140, over 90, then you were hypertensive, they would get you on meds, whatever. That's changed a little bit. Now they want you below 130 over 80. And that's the American Heart Association guidelines. So the reason they lowered those is because too many people were pushing those numbers high. And so if you can be under that 130 over, you know, and under 80 for diastolic, that's where you should be. And again, blood pressure is one of those that, while we may have genetic dispositions to, definitely reducing stress, increasing, you know, getting that amount of sleep that's right for you. And for some people, cutting out salt and things like that are really important. Drinking enough water. So yeah, those are a couple of instances where you need to get those checked on a regular basis. Blood pressure, you can check at home. The other labs that I think are important is if you have factors for risk for type 2 diabetes, getting that A1C. A1C is a much better look at your blood sugar over time than a one-time blood glucose. A1C measures the kind of how much sugar has been attached to those red blood cells over a period of 3 months, because those red blood cells only live for 3 months. So we get a good indication of where your blood sugar has been over the past 3 months instead of just a one-time. Those are really the labs that I think are important from a preventative care. You know, of course, if you're sick and you're coming in, they're going to look at your CBC, which is your white blood cells, and your CMP, which can include your electrolytes, your kidney functions, things like that. But again, that really depends on risk factor.
So I want to dive into something on a CBC because this comes up often, but CK, which is creatinine kinase levels, are essentially what occurs when muscle breakdown happens.
Yes.
And dealing with whether it's weightlifting, CrossFit, high endurance, what usually happens with those CK levels? And
those CK levels go up, and that can really throw a physician off because they're thinking myocardial damage. They're thinking, you know, inflammation within the body. And so, yeah, that can really throw off a primary care physician. So definitely let them know. I mean, if you've been doing a lot of CrossFit weightlifting, if you have been doing some endurance training, you're going to have high CK levels. So that's okay to have. Those are okay levels to have when you've been working out like that. Yeah.
Yeah. And we're talking relatively high, not like through the roof, rhabdomyolysis high.
Right.
Yes.
And not all the time. So if they're consistently high, yes, we can end up with some kidney damage over time. But certainly, most of us know that we ramp up our workouts, or we train for something, and then we give ourselves a little recovery time and then ramp up again. Or you reach a point where your body can handle what you're doing, and then you go back up. So in a healthy lifestyle or a healthy workout regimen, you should be giving yourself some recovery time to correct those.
Yeah. That is one with patients I've seen come up, and it's thrown primary care physicians off. So this is more of an opinion. How many primary care physicians would know appropriate dietary and lifestyle recommendations and modifications, be able to completely follow through with a patient on that? And I'm just asking.
So this is one of my big frustrations. I actually have gotten into discussions with dietitians in my field that also, I don't agree with. And I think that different physicians are going to have different recommendations. They've been trained different. I would hope that the physician that you are seeing is keeping up to date on the latest education around diet and exercise. I think that our research community has done a big disservice to patients, to the community, back starting in the 70s, 60s, and 70s. And I believe that there's been a change towards looking at more of a less skewed view of diet and diet recommendations. I think, it's been acknowledged that in the past there was a lot of lobbying by different groups to basically get their product into our American diet. So, definitely a provider who's pushing for those whole foods, the less processed foods. But I don't believe that physicians are specific, or even nurse practitioners and PAs are not specifically trained in nutrition. So if you're seeking nutrition advice, either asking them what their philosophy is and asking what their training is in that, or seeking out someone who can help you with that. Because definitely there's been a switch in the past, I would say even 10 years, about what we should be putting in our bodies. So
yeah. And I know oftentimes here we get people who will say, well, my doctor told me that I needed to eat right and exercise.
Yes.
Okay, blanketed term. What does that mean? And for many of these people who are, they don't want to take that blood pressure med, that cholesterol med, they want to control their blood sugar. And what they eat, or what they tell me they eat, they think is healthy. And a lot of it is processed, highly processed carbohydrates, and not a lot of whole foods. And so I think just being able to open people's eyes to what does proper diet and exercise look like? And that's going to look a little bit different for everybody, dietary wise. There's not one diet that fits all, or one, when I say diet, it means like the foods you choose to eat. We're not going on like restrictive diets here, but I think that's one thing that I would love primary care physicians to look at more, especially for people who don't want to take those medications.
Well, I think also, and this, while it relates very well to diet, it relates to healthcare in general. We also don't take enough into factor a patient's culture and their socioeconomic level, and how do those factors influence what they believe. If they believe that eating well is a frozen dinner that says it's healthy choice or something like that, then they they believe that's healthy because that's what they've been exposed to, and that's what they can afford.
Yeah.
Obviously going through McDonald's or something like a fast food restaurant is going to be cheaper than a bowl of fruits and vegetables. But there are ways, if your physician or healthcare provider is willing to work with you to make affordable changes and but it takes more time. Our healthcare system is based on, they're paid by how many patients they see a day. So for them to say eat healthy and exercise is faster than telling you, asking what do you eat? Tell me what you eat in one day. What does it look like? Where do you get your food? So those are big topics that take a long time to understand. So remember, when your doctor is saying that, ask them to clarify, what do you consider a healthy diet and what do you consider exercise? We all know that the American Health Association requires exercise of 30 minutes or more 5 times a week. Well, what does that mean to someone? If I tell them to exercise, are they going to go for a walk and never break a sweat? Or, and then what level are they at? Maybe going for a walk is where they're at right now, and that's okay. But yeah, it's all very dependent on the physician too. So
I think you alluded to something as to doctors, they have to see so many patients a day. And sometimes, even if they do have the knowledge and they do know, it's very time consuming to educate. And so what are your thoughts on how the EHP model is about how meeting with that health coach every 90 days can be an extension of healthcare? Do you think that's the next logical step? Or do you think there should be more contact than that?
I definitely think that is a great place to start. Meeting with the health coach every 90 days. I would be willing to bet that most of us, since I did discuss that most of us are not probably getting to the doctor yearly, unless you do have some healthcare issues, then we're certainly not meeting with our healthcare provider, our primary care physician, or nurse practitioner every 90 days. So meeting with that health coach is really important. And another thing that I know you and I have talked about before is setting goals. Physicians tell you to eat well and exercise, but don't set a goal for you. Where are you now? And again, that comes down to time. So having someone say, what are your goals for your health and what are your goals for your life? That really helps break down things into easier steps. I'm meeting with them every 90 days. You can go home from the doctor and say, I'm not going to see him in a year. He told me to eat right and exercise. I'm not going to start for, until 3 months before I see him again. So having someone hold you accountable, having someone to meet with you, and then reassess those goals and make sure that those goals are on track and attainable for you. We can set a goal of climbing Mount Everest, but if we are not ready and in that place, then that goal is not attainable for us right now, and that will only cause us grief. So yeah, I think it's important.
If anybody that's on, if you guys have specific questions, go ahead and put them in the chat and we'll end up getting to those. So when we were talking about some different types of testing, when would a primary care start to dig into more different hormone testing or food sensitivity testing? At what point would they bust into those types of labs?
So I think those types of labs are really important if you've started to have symptoms. I don't know that there's an age that's really set for either hormone testing or for the food allergy testing or allergy testing in general. Definitely if you're having symptoms, these problems tend to begin in the GI system, or the skin. They're two really large organs. So our GI system starts in our mouth and it ends at the end. So we've got quite a ways for food to travel, and all that time, what we put into our body, like we've already said, it depends on what we put into our body. And it can be healthy food. It can be, you know, whole grains. But if you're allergic to those whole grains, then that whole GI tract is upset. And then skin, we see a lot of skin problems because of allergens or because of dietary issues. So if you're having, you know, bothersome skin rashes or GI upset or irregularity, by all means, that would indicate that you might need to have some sort of testing. The first thing that a primary physician will probably do with GI problems is put you on a low FODMAP diet. So basically the FODMAP diet decreases the amount of gas preventing foods, kind of rules out some of the big allergens. The FODMAP diet, the problem with that one is it's hard to follow, but if you can do it for a while, it can be really helpful. And then adding those foods back in as you can. So it's sort of an elimination diet. It's the one that physicians use most often. As far as your thyroid, definitely if you have a family history of thyroid problems, have that tested. The closer the relative is to you, your mother, your father, your sibling, then the more likely you are to develop thyroid issues. And those don't just happen to young people and they have to live with it the rest of their life. Actually, by the time we're in our 60s and 70s, there's probably, I don't know the exact number, but the percentage of people with thyroid issues goes way up. So the thyroid just, for factors we don't really know, kind of quits working, quits doing its job. So if you've had, you know, the most common would be a hypothyroid, where the thyroid's not making enough T3, T4, and therefore your metabolism is slow. You're going to notice things like you're tired, you're fatigued, you're just don't feel well. So get that TSH, and then make sure they do a reflex T4, because it just tells you a lot more. If you get the TSH and it's high, you know, the T4 will tell you, will confirm that you have the hypothyroidism. So other hormone testing, estrogen, there's actually no recommendations for that from the US, like the CDC or the US Preventative Task Force. But again, if you're having problems, definitely ask about those.
I think as people get to know their bodies really well and they know like something isn't right? Like something is off. Like I'm eating decently, I'm sleeping decently, something's off. I think that's one of those big times where I encourage them to like, hey, like ask your physician about hormone tests, because like if hormones, I mean, they're the regulators of your entire body. Like if something's out of whack, it's gonna throw everything else out of whack.
Right. I see we have a question from Karen about postmenopausal nutrition. So again, a very hormone-based question. So the level of estrogen produced goes down when we hit that menopausal age. So definitely women notice their metabolism seems to be slower. They tend to feel like they gain weight, especially around the middle. And we know that with gaining weight around the middle increases your risk for cardiovascular disease. So menopausal nutrition can be kind of tricky. So one of the recommendations that had been made in the past and isn't so much made anymore was to add soy products to your diet, because soy is sort of has some of the same chemicals that mimic estrogen. It's not really recommended that we try to replace your estrogen with soy products anymore. The best we can do is try to continue that whole foods diet, and again, it's sort of an individual. We all hit menopause at sort of a different time. It's very genetics based. So yeah, and just trying to stay active, because the hormones are going to make you feel irritable and not want to do stuff. So so yeah, just trying to keep your nutrition in check.
One thing that we usually work with people too is that sometimes women do better with like no carbs, but that usually isn't the case because they're also wanting to be active. So if you eat no carbs and you want to be active, that doesn't usually fare very well. And so I've also had a big conversation with a functional medicine physician now, Trevor, and we just talk about making sure there's some balance of fats, proteins, and carbs so that your insulin levels don't skyrocket as they try and combat that blood sugar level. And so we just try and make sure that like each of those meals is balanced, and that like, hey, if you're going to have a piece of bread, you need some protein and some fat with it, and hopefully some fiber too, like some vegetables, so that it your blood sugars don't elevate and stay elevated for that.
And just to add, you know, the other thing is stress. So if we can reduce stress, we can reduce those cortisol levels. That's that stress level that naturally wants us to hold on to those calories. So just keeping stress in check, whatever that is for you, if that's some quiet time reading, look for those opportunities to decrease stress. Sometimes it's just breathing, like take a moment, close your eyes, breathe deeply, bring that heart rate down, because all you have to do is send those messages to your brain to calm down, and they will. So decrease that heart rate, decrease the respiratory rate. Yeah.
Fun little fact too about breathing. Right under your diaphragm, there's your main drainage lymphatic vessel called your cisternae chyli. And when you breathe and you move your diaphragm, not only does that change your blood flow, but it changes your lymphatic, basically lymphatic's ability to cleanse your body and rid you of toxins. So if you just breathe through your chest and you don't take full deep breaths, you are not allowing your body to cleanse itself, and you're getting backed up with toxins. So breathing is good for the brain, but also your lymphatics. So I just want to throw that little tidbit in there because I love breathing. There's one last question, because I know we're trying to keep these to 30 minutes. Say you do go to your annual exam and they want to put you on a medication. Let's say it's like a blood pressure or cholesterol med. Those are pretty common. At what point do you talk with your doctor about, hey, let me try and make some like physical changes, lifestyle changes? And at what point do you just say, okay, I'll take the med? And like, is there a level at which is unsafe for you to try and make those changes? Do you co-manage with the med, or you just try and like seek coaches and do it on your own?
So a really good example of this is in type 2 diabetes. Metformin is used quite a bit as a first line for type 2 diabetes. So if you go in and your A1C, so A1C is that number I talked about, it gives you kind of an average of what your blood sugar has been over the last 90 days. If your A1C, we like it under 6, but if your A1C is 7, that, you know, that's telling us that your blood sugar has been elevated over the last 90 days. But honestly, 7's not a horrible number. It's high. But certainly the recommendation is that you would start metformin at that point. And I know that many of us would be like, well, let me try my own thing first. It depends on how motivated you are to change. What are your goals? If your goals are that I honestly am going to drop everything and work on this right now, then maybe you don't need the metformin, and then you need to get back in 3 months to get that checked. But I would say that if you've struggled with this in the past with losing weight or diet or exercise, maybe start the metformin, work on those goals, and then get checked in 3 months. And I feel the same way about blood pressure. the last thing you want is someone to start a blood pressure med and their blood pressure drops and they don't feel good while they're trying to work out and make lifestyle changes. So if your blood pressure is moderately elevated, if you are 140 consistently over 90, work on those lifestyle changes if you believe that you can fix this within 3 months, or at least improve it in 3 months. You can always quit these meds. That's, I think, the goal, or at least my goal as a healthcare provider, is to give people the tools that they need at the time, and then with the hope that they can quit them at a later date. You don't have to be on metformin the rest of your life. It's type 2 diabetes doesn't have to be a lifetime issue. High blood pressure doesn't have to be a lifetime issue. These are preventable illnesses that can be reversed. So that's important to remember. I also don't want people to get frustrated if they do need help with a medication for a little bit. Medications like metformin and blood pressure meds have been used for decades, relatively safe, few side effects. And metformin might help some people lose weight, and maybe they will feel more comfortable towards their goals. So that would depend on your motivation to make changes in your life, because you're not going to fix these problems overnight, because they didn't come overnight. So yeah, that's what
that's awesome advice. Just so our listeners know, we are not telling anybody to stop taking meds before talking to a healthcare provider. And I think the big question to talk to your healthcare provider is like, hey, like if you have to, like, I'm going to go on these meds, but like my goal is to get off of them. And I think sometimes healthcare providers don't always ask the patient what their goal is. They're just trying to get your numbers to an adequate level. Oftentimes people who are probably listening to this, your activities of daily living are probably not what the typical person's activities of daily living are. We tend to have an audience that seeks more out of life. And so being able to tell your doctor your goals and have that conversation, I think, is a really great tool too.
Yeah, just one last thing to kind of wrap it up is that go to your appointment prepared. Take your goals, take your healthcare goals, take your physical goals with you, and then take your med list, look at it and say, hey, what can I get off of, or what do I need? And make sure you're working on those preventative cares, because physicians' payments are tied to getting many of these preventative measures. They will probably remind you to get all your preventative cares in. But if there's something about, like your thyroid, that's a family thing, and they don't, put it on your list. Go to your appointment prepared, have a list. Know what you want to talk to them. They don't probably have a lot of time. So make sure you get every question you want in there.
Awesome. Thank you so much, Joey. And as you go through graduating school, I'm sure we will pick your brain plenty more in the future. Thank you so much for joining us today on the Healthcare of the Future's Monthly Talks.
Thank you.
Thanks.